Our emergency room was built in 1971. The last remodel was in 1994. And at that time, I'm sure it was the top of the line.
So it's been 3 decades. We have certainly out-phased the environment over the last 30 years, and expectations of not only our patients but of ourselves have changed during that time.
There's not a door between our nurses station and where patients walk, so it would be very easy for a patient to try to hurt staff members.
Voices carry throughout the department. We need to do a little bit more with privacy for our patients and for us.
There's three beds in this room here, separated by nothing but curtains. So what is being said in this room or what is being done in this room can be heard 2 beds down very easily.
I think our bathroom in our bay right now is a big privacy issue, since we only have one and every patient has to use that one.
So if someone's coding in the trauma bay and they're working on them and someone else has to go to the bathroom, well, they're either tiptoeing through or else they have to wait. So I just think the layout needs changed.
The doors with the behavioral health room, it's supposed to swing both ways, but it doesn't. So we've had instances where 2 police officers bring somebody in and the female police officer was trapped behind the door. The patient had her pinned against the wall and we couldn't get in to help her because the door wouldn't open.
As far as our behavioral health patients, we have just one room for the entire department. And in a community of over 20,000 people, and with mental health illnesses being 60% of all ER visits, that's really inadequate to properly serve these people.
There will be times here in the emergency department we're a 9-bed ER, and we could have up to 4 to 5 psych patients, which is obviously around 50% of our functioning ER beds, and we're just awaiting a bed at another facility in the state. And some days it's days before those patients are moved. So, here in our 9-bed emergency department, those beds will be shut down for days.
A lot of the community itself doesn't realize we may have 9 beds, but we may have 3 or 4 taken up by people who need our help that are here for long-term rather than short-term. And so it gets a little frustrating for people when they can't get in and out, not realizing how many mental health cases we do have. Things are changing, times are changing, and everything changes in medicine. So it's very important that we stay with the times and get updated and so we can play a better role in our community.
And so our community is telling us, begging us to please do something to provide a better environment of care. I strongly feel that it's our obligation to make that happen and to find ways to improve the environment in our facility, to improve the standard of care here.